It's lovely to meet you. Please don't be nervous. Today is going to be very, very simple. I'll talk you through everything that we're going to be doing. I promise you, there's nothing to be afraid of. Alright? So, all we're going to be doing today is I'm going to be applying some concentrated solutions to your skin. I'll actually be applying them to your forearm, okay? And I will talk you more through it, but that's the gist of what we'll be doing, okay? Good. We'll all stay calm and relaxed. It'll all be fine, I promise. Now, we do need to begin with a little bit of a questionnaire, okay? So, let me get my notepad now. Alright, so I need to know to start with, were you referred to us from your doctor, or have you come here yourself? Okay. And what's the main problem that's made you book this appointment? Okay. Okay, so it's more curiosity. Okay. So you've experienced some mild allergic reactions, but it's more just sort of an interest in it. Okay. Okay, so a friend of yours had this done. Yeah. Okay, well, that is not a problem at all. We get lots of people who come to us and just want to discover if they have any underlying allergies, so that's not a problem. Okay, so the allergies and symptoms that you have experienced, how long have you noticed those for? Okay. And have you found those symptoms getting worse over time? Okay. Right, about the same. That's fine. So, I've got quite a long symptom list here, which I'm going to get through. So, do you have any of the following symptoms? Okay. Cough. Okay. Wheezing. Shortness of breath. Chest tightness. Sneezing. Runny nose. Nasal congestion. Itchy nose. Itchy and watery eyes. Postnasal drip. Phlegm. Nasal polyps. Poor sense of smell. Ear infections. Sinus infections. Blocked ears. eczema, hives or swelling, fatigue, snoring, headaches, any other symptoms that I haven't mentioned? Okay, great. Now I'm going to read you through another list, and this is a list of potential triggers. Okay, this isn't a fully extensive list, but it's some of the main ones that we come across. Okay, so again, just yes or no. So, grass. Okay. Hay. Mold or mildew. Basements. Okay. Leaves. Cats or dogs. Okay. Horses. Any other animals? Okay, yeah. Alcoholic beverages. Cosmetics. Aerosol sprays. Perfumes. Insecticides. Odours. House dust. Smoke. Pollution. Exercise. Nervousness. Cold air. Humidity. Weather changes, or latex rubber. Okay, wonderful. When do you find your symptoms are worse? What time of year? Okay. Yeah. Are your symptoms better away from home? Okay. Have you ever had a skin test? No. Okay. Sorry, there's just a few more questions. But it's important that we go through this. So, what do you do for work? Okay. Have you ever had any allergy injections before? Okay. Have you ever taken any medication for allergies? Okay. How long have you lived in your house or apartment? Okay. Do you know how old it is? Just because we do find with some older properties there can be some additional issues. Okay, great. It's not a problem then. Do you have any pets? Okay. Do you smoke, or does anyone in your household smoke? Okay. Do you have allergy-proof pillow and mattress protectors? Okay. Do you know how old your mattress is? Okay. So, I just need to ask you a few questions about your medical history. Okay, so I just need you to let me know which of these apply to you. So if you have any of these currently, or you have experienced any of these things, and just let me know. Okay, so diabetes, high blood pressure, liver disease, any heart problems, osteoporosis, glaucoma, asthma, kidney or bladder disease, anemia or any type of blood disorder, and back problems, peptic ulcer, arthritis, heartburn, migraines, seizures, depression, loss of hearing, just a few more, hay fever, cataracts, I think I might have gone through them all. Yes, lovely. Okay. Have you ever had ear, nose or sinus surgery? Okay. Have you ever had any allergic reaction to any medication? Okay, great. Perfect. I think that is everything I need to know for the moment. Wonderful. Now, what we're going to be focusing on today is sometimes known as a scratch test, more commonly known as a skin test. And as I mentioned at the start, all I'll be doing is applying a mix of solutions to your forearm. I'll be dividing it up into sections, and then I'll be doing just a little bit of a scratch, and we'll just see if any irritation occurs. Normally it's easy to tell within the first sort of few minutes if there is a reaction, but it will let me know if there's anything we need to explore further, if we need to do any blood work, and obviously what treatment plan we need to discuss. Okay, but I think today, based on your answers, this is going to be more an exploratory sort of thing. Nothing that you've mentioned sort of flagged my attention, so yeah, I think we should be okay. We'll also be testing for the Big 8, as it's known in the world of food sort of allergies. So this is milk, eggs, fish, crustacean, tree nuts, peanuts and wheat. I always try and get those off in my head, and then I end up missing one, but there we are, the Big 8. So we'll be doing a test for those as well. Okay, so let's pop that down now. Okay, so I'm going to need you to just roll up your sleeve. It can be done on either forearm. Okay, so I'll let you pick. I will get my gloves and we can get started. Okay. Not that you have a latex allergy, or so you don't think, but these, just to put your mind at rest, are latex-free gloves. That's perfect. How are you feeling? You okay? Good. we're going to start by cleaning the area. So this is an antiseptic towelette. This does not irritate the skin, it doesn't have any perfume or anything in. So it's just gonna ensure that skin is just nice and clean. It's nice and cool as well. Okay, so just hold out your arm, that's perfect. And as you can see, let me just, there we are. There's a little bit of a rest for you. You can just rest your arm. Perfect. We're going to cleanse the arm then. Okay, perfect. It was very cold. I just put that to the side there. Great. Now what we're going to do is I'm going to mix all the solutions here. Okay. Now, this is the one we're going to start with. Okay. So I'm going to divide up your arm first. Let me just get my little pen. I will wipe this off, don't you worry. This is safe for the skin. So I'm going to be dividing your arm up into different sections, okay? Just so we can monitor the different zones. So we just come down. Sorry, it tickles a little bit. We'll go across. 1, 2 and 3. Wonderful. Okay, and I'm going to get my little Q-tip here from my pocket, and I am going to drop the first solution onto the skin. Okay. Okay. Good. Place that back. I'm just going to tidy around the edge with my Q-tip. Okay. Fantastic. That's the one that actually tests for the Big 8. So, okay. Now we're going to move on to the others. The next one. Doing okay? Good. Okay. So just get a little bit. And we'll just dab it on. This is going into zone B. Okay. Good. Just that's staying nice and still actually. Doesn't need to be wiped. Okay. Good. Place that over. We'll take our next one. Okay, and place that into zone C. Just tidy that around the edge there. Okay, good. You're doing really, really well. Really well. Okay, we'll take our other one. zone. Okay, good. All good. And last one. Okay. Lovely. Perfect. Now, this is the part where I'm going to do a very light scratch to the skin. So for that, I have my little implement here, and I simply am just going to edge away at the skin very, very gently. Okay, so let's try that in zone A now. Okay, next zone. I wouldn't expect to see a reaction within sort of seconds. It will sort of start to come up, but that's good. Okay. And last section. Okay, good. Let me just give that a wipe. Okay, so we'll just give it a minute or two. It's normally within the first couple of minutes that I'll start to notice something. I'm going to use a special light pen that I have just to take a little closer look at the skin whilst it's activating, as it were. Okay, so this is a little special light pen. I won't go into the technicalities of it too much. I'm just going to have a little look. Okay, so no signs of anything yet. Whilst that's doing its stuff, I'll take a little look at your face as well and your neck. Okay, so just nice and still. Sometimes the reaction can show up elsewhere. Find the face and neck to be quite common places sometimes. If this is uncomfortable for your eyes, you just let me know. Okay, good. Okay, right. All all seems to be fine. Okay, now let's take a look. I'm just going to grab an extra Q-tip. Okay. Right. I'm seeing a tiny bit of redness in zone B. Okay. Now that zone indicates some household allergies, so things like dust, pet dander, things like that. The big 8 zone doesn't seem to have been activated. And the others seem okay. Okay. Now, I am going to leave these solutions on your skin. These are ultra concentrated ones, and we'll leave them on for about 30 minutes. I'll ask you to wait in the waiting room, okay? But I see no sort of signs for concern. Now, you did mention you have hay fever. Do you take anything for that? Okay. I may recommend trying just an over-the-counter hay fever tablet. Look for a non-drowsy one, especially if you are driving. And I would say when your symptoms flare up, if your allergies are particularly bothering you, you can take them, every day, once a day. But if you feel fine, I wouldn't take it just for the sake of it. Okay? So, what I'm going to do now is I'm just going to apply 2 more special drops. Okay? Now, just get my bottle just here, and I'm going to place a little plaster over these because I want you to keep these on your skin for 24 hours. Okay, so let me just place 1 drop there and another here. Okay, they're just going to rule out some other things. I won't go into details too much, but I will place a little plaster over. Okay, so just a little round plaster like that, and we'll just place it over there. Great. Okay, is that comfortable? Okay, get another one out. Okay, pop the other one on. Okay, well, as I mentioned, I'm going to ask you to wait outside in the waiting room. I will come and just check on you in about 30 minutes. That's just so I can be sure that there aren't any other reactions based on those main zones. Now, those other 2 areas that I've just applied, if you could just try and keep those nice and dry. I know that's a little easier said than done. So, when you go in the shower, I would recommend placing this over the top. I'm going to give you a little reel of our tape. You can just place this over and place the tape on top, okay? And then if you like, you can wrap some cling film, if you have any, over the top. Great. Now I'll give those to you, okay? If you notice any reaction at all, so that's any itching, swelling, redness, give us a call and I'll ask you to come back in. I don't think you're going to have an issue, but just in case you do, please call us, okay? And even if you do, it's not cause for alarm, it just means I need to run some further tests. Okay? So, Do you have any questions at all? You are more than welcome. I'm glad I've been able to put your mind at ease a little bit. Not a problem. So when you're ready, just make your way to the waiting room, make yourself nice and comfortable, okay? And I'll check on you in 30 minutes, okay? But I'm sure all is fine. You're very welcome. Alright then. Okay, so let me see. Just set my alarm for 30 minutes. New alarm. Okay, perfect. Right, just go and check with Claire for my other appointment. I think I'm clear though for an hour. That's fine. Okay, go and do that